I tested positive in 1986. I think that was the same year when the antibody test was available. So my personality type is I wanted to know, and I wasn't happy with the results. I remember going and getting the test with a friend, and his was negative, and just feeling a lot of shame and isolation at the time. I think it took me, well, maybe it was a few weeks, I don't remember now. It took me a while before I reached out to family, but I do remember calling both my brother and sister and talking to them. It made a difference, and I realized that eventually I needed to tell my parents. About 5 years before that, my brother, who's gay, we came out to my parents together. We knew that our parents were going to support me just because of their reaction to our coming out as gay. And I can't say how much that's made a difference to me. Part of the reason why I was able to do what I did over, you know, being an activist or being in HIV for so long, or even just surviving and living fairly healthy over this time, is because I had my family supporting me. My parents telling me they accepted and loved me. I know it's also made a difference to many of the friends and people that I've worked with in HIV over the years, seeing how openly supportive my parents have been. Many of them didn't have that experience with their families. I think my journey as an activist started the same time in really coming out as a gay Asian man. One thing about, I think, the epidemic among gay Asian Pacific Islander men was that along with fighting the epidemic, we were also building a really resilient community. To see myself in community with other gay Asian Pacific Islander men was a big deal, and I knew it was a big deal for other guys too. So just by organizing those early support groups and conferences and educational and cultural activities and things, that to me was activism, because it was actually in direct contradiction to the racism and homophobia that we were all experiencing. That eventually led to more political education and seeing that we could change things in our systems, not just seeing it as HIV prevention, but also about building our sense of self and a connection to each other beyond our families. I was a part of some of the federal policy advocacy in the mid-90s. It was a time when President Clinton had just, the year after he stepped into office and formed a Presidential Advisory Council on HIV/AIDS. One of the things I remember is that the council was made up of a good number of us with HIV, and that made me, and I think others, hopeful that that after a line of horrible presidents who wouldn't even talk about HIV, that Clinton might do something. What was really powerful was the coming together of people living with HIV across communities to advocate together. Also during that time, gay men of color were organizing Native American, Latino, African American, and Asian Pacific Islander communities. We all worked together to basically have a national campaign for the Centers for Disease Control to start targeting resources to our communities, to our populations. And that was a big deal. I think it took a lot to build trust among our different communities, to know that we had different impacts, yet we were all fighting the intersection of homophobia, racism, and to some extent classism in the epidemic. Many of the people who, were needing help and that really we were trying to organize a community around were invisible in all kinds of systems. Part of that was the reality that in many states and many parts of the country, you know, the total aggregate of all of our communities might be 1% or something. And also just really the fact that many of the first folks who had HIV in our community and continue so are gay and bisexual men, that was a huge lack of visibility around that when HIV started. That wasn't the case in San Francisco. In San Francisco, we knew that the 1980 census at the time showed that at least in terms of East Asian populations in San Francisco, it was over 25%. And so we actually knew that we had a responsibility, and we actually had the ability to use our political power to make those issues visible in San Francisco. But that wasn't the case in the rest of the country. If you go back 30 years ago when HIV was first appearing, not only was sexuality not talked about, but substance use, mental health, domestic violence, or violence in the community. They were all issues that were really just beginning to become important enough for people to break the stigma of silence around. I remember going to high school with someone who started up one of the first Asian women's shelters, and that was right about the same time that the HIV work was beginning. So many of these issues have been able to be seen as something important for communities to recognize as well as for families to talk about. There's still stigma that are based on cultural norms, but I think a lot of that has changed too. I remember learning about the model minority myth in around 4th grade. I almost remember it as almost like a civics lesson or something like that. Like it was being taught as a part of how to be a good citizen. And the public school that I went to was about 25% Asian. So there were a lot of us in the classroom. And I just remember hearing maybe for one of the first times this kind of like educational lesson that Asian Americans were successful because a particular sort of cultural trait of working hard and valuing education. There are probably some things that line up in our values and certain Asian cultural values that are true. At the same time, it wasn't true that we were successful just because of that, but more for the kind of actual color hierarchy that we all functioned in public school, in later in higher education, in all ways of employment that have in some ways separated out Asians, or at least East Asians, from other people of color. It played out in the epidemic again and again in terms of basically sometimes public health saying, well, you all are self-sufficient, you could figure this out. And I think I get angry sometimes thinking about how out of desperation, sometimes we actually believe that. It did help us to organize ourselves. At the same time, it prevented us sometimes from being truly in support and in solidarity of African American men and women who were being hit harder by the epidemic, or all the other communities of color that also needed resources and were being ignored. One thing that was really special about the early years of the epidemic was the role that women in our community played supporting gay men through the epidemic. There's one woman in particular who I remember, Lenore Chin, who's a San Francisco artist and cultural activist. She was one of the main organizers of an effort of lesbians in the community to donate blood. She did that on her own, meaning that it was not something we asked for. They organized themselves to do that. And there's countless other stories of API women and particularly lesbians who donated, who showed up at our events, who volunteered in some of the first sort of emotional practical support programs that we organized. Yeah, they were there. And I do think that that's a part of what the HIV movement helped to foster, was a sense that we had an enemy that was a virus, that was an unresponsive government, that was a society that divided different communities. But the more that we were able to reach out and to know that along with fighting, we actually needed love. We actually needed to love ourselves and to express our solidarity and love with other communities, that's how we're going to build a stronger movement. And I think that's one of the things that I experienced in the work, was people finding places for joy as well as grief.